what's the best diagnostic testing? Because I've definitely heard that there is debate on certain type of Lyme tests.
Mhm.
Some are more accurate than others. And what is your opinion?
Yeah, I mean, there was a really interesting what they call meta-analysis where they kind of they take a look at all the papers out there and pick out the really high quality ones and say, if we pull all this data, what is a great recommendation that can come out of it? Can we glean any evidence that's those studies alone couldn't do? And they found that the typical two-tiered CDC recommended testing, which is a screening test, an antibody screen, followed by this Western blot test, is about 56% sensitive, but it's 99% to 100% specific. And in English, that means if you do that two-tier test and they say it's positive, it's pretty much a done deal, 100% you're positive. But if it says you're negative, we can miss 44% of people who are truly positive. So 88 out of every 200 true positive people are missed with that testing strategy. So it's essentially a flip of a coin.
So basically, it has a very low risk of false positive. If it comes back positive,
you're positive.
You can be pretty certain you're positive. But if it comes back negative,
high risk
you
of
still might be positive.
Right.
Okay. So
there's a couple ways to sort through that, right? I mean,
Yeah.
one of them is the erythema migrans rash in an endemic area, which is most of the country. I mean, or people travel to the Northeast, upper Midwest. Those things, that's positive, right? You don't have to, it's kind of like, go to jail, don't pass go, the whole monopoly. They just like, you don't need a test, because if you do a test acutely when you have a rash, the likelihood of a false negative goes through the ceiling. So rash in the right locality is 100% diagnostic. Now, the next thing is migratory.
Plus confirming the tick too, right? Would add
absolutely.
But there's no better testing strategy.
No, not really. I mean, Lyme is a clinical diagnosis supported by laboratory data, not the other way around, because there's no test that 100% says no, and there's very few tests that 100% say yes. Like if we do the double testing, it's pretty dang close. If you happen to get DNA of Lyme or Babesia, it's like you're clear. But the problem is the negative test doesn't help. And so what we look at is we say, what are there common symptoms that will really help us, right? Certainly, if you have a history of tick bite, obviously that helps, especially if it's a deer tick, because that's the only one you're getting Lyme from. Then joint pain and muscle pain, summer flu type symptoms are really commonly described in Lyme. But migrating joint pain and migrating numbness and tingling are ones that are much more specific to Lyme disease than, say, just pain.
And how quickly would someone experience these symptoms after a bite?
Anywhere from a week to about 4 weeks. And some people, it's months. So you can actually have people get bit in August, September, and they don't have symptoms till February.
Got it.
But
so there's no telltale immediate. I mean, obviously the rash is one, but
correct.
Beyond that, it might not be.
Going back to kind of play, just to balance out sort of what I was trying to say earlier, was why are people arguing about this? Well, part of the problem is we know that anywhere in medicine where there's not a clear-cut diagnostic test and a clear-cut treatment, there's a lot of experts who are doing their best and they're just butting heads often because we don't know the right thing. And the fact that like you could get bitten in August or September when you're on a trip to the Cape, and then you can be back in Kansas or whatever in February and get Lyme disease, it's problematic, because we don't have really definitive stuff. So people are working on that. But I think that that's also what separates a lot of us, is we're all trying to do the best we can with a few people with ulterior motives. And it's just, the research just hasn't caught up yet,
Thanks for watching. If you like what you just saw, why not subscribe? Here's a link to do that. And if you'd like to watch the full interview, you can find it at chrisbeatcancer.com. There's a link to it in the description right below this video.